Hello guys, my name is Dr. Padima and I am from South Africa, Limpopo, Polokwane, at a small village called Wotropo. Some people know it as Matox. And I am currently doing my medical internship in a hospital in Tanzania. I studied my bachelor in medicine and surgery at a university in China called Jiangsu University. It's located in Xinjiang, around the Jiangsu province. And I graduated in 2020, around June, July. Because there was the COVID, I didn't really get to go and graduate in person, so all my papers were mailed to me, which was kind of sad. And I always keep telling myself, one day I'm going to crash someone's graduation. Studying medicine in China was an experience. It was a huge experience. Firstly, it comes with a cultural shock. You are in an environment that you don't know, that you've never been to. And when you get to that environment, you have to adjust. You have to adjust to the environment, you have to adjust to the language. You have to adjust to the people, which can be a little bit hard. And for me, the school part of it wasn't that hard because I studied BSc in Wits University. First year and second year I was majoring in anatomy and physiology. So everything that was done in first year and second year was a little bit easier for me, and I didn't really have to study for it. So I was trying to understand the other side of life, which was the language. Studying in China, I feel like it was like studying at any other university, medical school, but at the same time, because it is China, I was fortunate enough that I wasn't studying in Chinese, I was studying in English, so it made life a little bit easier. So my teachers knew English, my classmates were from all different parts of the world, which was an experience too. When you study in China, you have to do a lot of things by yourself, like to go the extra mile. For example, if you're going for hospitals, when you get to the hospital, you have to show the lecturer that you're actually interested in learning. You have to stay late at the hospital, you have to go to hospital on your own so that you get more exposure to patients, because there's this stigma that happens in China, and not only in China but I hear in other Eastern countries where you don't get to go hands-on that much, which is kind of true. So if you really want to practice, you have to be persistent. So that's what I was doing during my medical school, so it was more of going the extra mile to get there. As a medical intern, my role at the hospital actually was almost the same in all departments. Firstly, your role as an intern is you're like the security guard of the ward. You need to know everything that happens in the ward, from the nurse's part, to the specialist part, to the registrar's part, medical officer's part. You have to know everything that happens. Because as an intern, your role is you get to clog the patients, you get to re-clog the patients when they're sent from specialists, you get to do the orders, you get to follow up on the orders. When the specialist calls and says, the CT on patient A, what were the results? You're supposed to know. When they ask you, what's the blood pressure of this patient, you're supposed to know. You're supposed to know what happens during the rounds. You're supposed to do your follow-ups. You're supposed to, you become like the spokesperson of the ward, I should say. You and the ward become one. You know the patient, you communicate with the patients, you stay with the patients the most. So your role as an intern is to do that and to also acquire as much knowledge as possible from your specialists, from your registrars, and from your nurses, because those people have the most experience. Medical school did prepare me for being an intern indirectly, because you know, in the Chinese system, you go to school for like 5 years, you do intense theory work. We do go to hospital for practicals, by opinion. During our 6th year, you choose a country of your liking and you go to that country, and that's where you go for your practicals. So all those 5 years, practicals are going to be put into that 1 year. You're going to sweat, you're going to go all out. That's when you become a pre-doctor, because we call it pre-internship, or some people just call it as an elective. So since that year is still part of medical school, I would say yes, medical school did prepare me to become an intern, because I did my elective pre-internship in Botswana. When I came to Tanzania, adjusting to the new life of being an actual intern was a little bit easier. I already knew the ropes, I already knew the medications, I already knew how to put IV lines, I already knew how to do lumbar punctures. So I was adding on to the knowledge that I've learned. Somehow medical school did prepare me for internship. All the pressure that runs around it, I was already aware of it from my 1 year of pre-internship, which was a fruitful one, and thank you guys from Botswana, you were the best. Yes, there were a lot of adjustments. In Asia, in China per se, it's a very fast-paced country. It's a country where a lot of things are in order and a lot of things are systematic. And we have a lot of equipment, we have a lot of medication, we have bone scanning, we have a lot of advanced technology. So, and also even how things are done in China are different from here. So when I came back to Africa, I had to readjust. I had to learn how to put cannulas by myself, because in China, we really did that because the nurses got everything covered. While as in Africa, you have to, we're understaffed, we're under-equipped, we are under everything. So have to adjust to doing the stuff for yourself, going to look for cannulas, putting the cannulas yourself, improvising on lumbar puncture equipment, improvising on plural tap equipment. You sometimes you don't find the plural tap set, and you have to do it. You have to improvise with cannulas and so forth. So I did have to do a lot of readjustments, the medications, the ethics of medicine. So you do have to readjust into the African guidelines. So it's actually a little bit of a challenge, but if you're open to learning, open to being taught, open to being advised, then it becomes a little bit easier. My least favorite rotation was internal medicine. Oh my god, internal medicine will have you by the neck like this, like ah. That's what happens in internal medicine for me. Internal medicine was the worst rotation for me. Like, it's demanding, it's hard, it's tiring, the calls are intense. It's just, I have no words to explain it, but yeah, that's internal medicine for me. Obstetric and gynecology, yeah, OBGYN gang. I actually enjoyed OBGYN. Everything is systematic, everything is in order, the stuff is so nice, and they're willing to teach you, they're willing to allow you to do your work, allow you to go in between the ropes from antenatal, postnatal, gynecology. You get to learn so much, and the stuff is just so welcoming. And surprisingly, it's like it's all the OBGYN departments. In Botswana, they were so nice. I got to learn so much, I got to do so much. On specializing the next 2 to 3 years, and I have a dilemma. I have obstetrics on one side and I have orthopedics on the other. So either one of the two I'm going to specialize in. I love orthopedics so much, but the workload is, it's intense. Because when you want to specialize, you're supposed to start thinking of your hospital life and your personal life. I'm a person who has a lot of extracurricular activities, a person who does business on the side. So I'll need to be a little bit more flexible. So I'm still weighing between the two, but either orthopedics or gynecology. When you go for internship, all the knowledge that you got from school, keep it in your head. The knowledge is going to help you, but don't be too smart. Allow people to help you. Take advice. Learn from the nurses. Be good to the nurses. They can either make your life or break your life. Learn as much as you can from the specialists, because after 2 years or 1 year, you're going to be sitting in the registrar's chair. You're going to be sitting in the medical officer's chair. And learn from your peers. Learn from your peers. Just know that what you learn in the book does not always come as the book says. Some things you have to improvise, and that's where the nurses come in. That's where people with experience come in. So, as the new interns are coming, I'd urge you to, like one of the doctors at my hospital likes to say, when you're an intern, you don't know anything. At first I was taking offense, but as time went on, it's actually a way to save yourself, a way to learn more. When they ask you, have you ever done this before? If you know and you're 100% sure, yes, go ahead. But if you're 70, 50% sure, say I don't know. They will teach you, and the knowledge that you have, you put it together with what you're being taught, you become wow. So be humble, and let's get this. 2021 interns, all the best. It's gonna be a good year. It's gonna come with a lot of suffering, a lot of hardship, a lot of emotional breakdowns, but have a good support system, talk to people, and don't just be yourself by yourself in the corner, because it can get really hard and devastating. So be open to talking to people, and self-care is important. You guys got to enjoy this video, and please like, subscribe, share your experiences below, and subscribe to Clinical Medicine with Dr. T. And to all the interns coming, we welcome you to the medical field, welcome you to the hospitals. Come show us how good you are, and don't let anyone tell you that you cannot, because you can.